The ethical issues surrounding AI medical guidance are profound and largely unresolved. Three central concerns dominate: responsibility for errors, consent for data use, and fairness given bias in training data. Starting with responsibility, when AI provides medical guidance that harms someone, who bears ethical and legal liability? The user for trusting a machine? The company that developed and deployed the AI? The healthcare system for being so inaccessible that people felt forced to rely on AI? This question has no clear answer under current legal frameworks. Traditional medical malpractice law assigns responsibility to licensed professionals who have training, certification, and insurance. AI companies typically disclaim liability through terms of service that users accept, often without reading. Users are warned that AI is not a substitute for professional medical advice, theoretically placing responsibility on them for choosing to rely on it. This allocation of responsibility is ethically problematic. Users often lack the expertise to determine when AI guidance is reliable versus dangerous. They may be driven to use AI by desperation, inability to afford or access real medical care. Holding them responsible for poor outcomes when they had limited alternatives seems cruel. Companies that profit from AI health tools should arguably bear some responsibility for harm caused by their products, just as pharmaceutical companies are liable for drug safety. But establishing appropriate liability frameworks is legally and practically complex. We need accountability structures that protect users while not being so punitive that they prevent beneficial innovation entirely. Consent for data use is another major ethical issue. When people share health information with AI, are they truly giving informed consent for how that data will be used? Most users don't read terms of service and wouldn't understand them if they did. The legal fiction that clicking "I agree" constitutes informed consent breaks down when agreements are deliberately complex and users have no realistic alternative if they want access to the service. Ethical consent requires that people understand what they're agreeing to, that they have genuine choice, and that they can withdraw consent. Current practices often fail all three criteria. Health data is particularly sensitive and should arguably have special consent protections. People should explicitly opt in to data collection and use, with clear explanation of purposes. They should be able to use AI health tools without their data being logged or used for model training if they choose. They should be able to delete their data. They should know whether data is shared with third parties and for what purposes. These protections should be legally required, not left to company discretion. The power imbalance between users and technology companies is too great for voluntary corporate responsibility to be sufficient. Fairness and bias present perhaps the most challenging ethical issues. AI training data typically comes from published medical literature, clinical databases, and internet sources that reflect existing healthcare disparities and biases. If AI is trained primarily on data from white patients, it may be less accurate for people of color. If training data reflects gender bias in medical research and practice, AI will perpetuate those biases. If data comes predominantly from wealthy countries, AI may provide guidance inappropriate for resource-limited settings. These biases can worsen health disparities. If AI works well for privileged groups, but poorly for marginalized ones, it becomes another mechanism of health inequity. Addressing bias requires diverse training data, careful auditing for disparate performance across demographic groups, and ongoing monitoring of real-world outcomes. When disparities are found, they must be corrected through model improvements and potentially by limiting deployment in contexts where the system doesn't perform equitably. The ethical principle here is that AI health tools should reduce health disparities, not worsen them. Any system that provides better service to already advantaged groups while providing poor service to marginalized groups should not be deployed, even if it's better than nothing for some users. Transparency about AI limitations and provenance of medical claims is ethically essential. Users should know that they're interacting with AI and understand its limitations. Every medical claim should ideally be traceable to source evidence, allowing users to verify information. When AI is uncertain or making probabilistic estimates, this should be clearly communicated rather than presenting uncertain information as fact. Systems that present AI-generated content as definitive medical knowledge without acknowledging uncertainty or providing source citations are ethically problematic regardless of accuracy. Human oversight for critical recommendations is another ethical imperative. For decisions with significant health consequences, whether to seek emergency care, whether to start or stop medications, whether to pursue invasive procedures, AI recommendations should ideally be reviewed by humans before reaching users. At minimum, there should be clear pathways to escalate to human consultation. Fully automated AI providing high-stakes medical guidance without any human checkpoint represents an ethical boundary we should be very cautious about crossing.